Hello, in this video we will discuss about the gingivitis. The teeth anatomy we will also learn, and next we will understand about the gingivitis. This is the disease due to the bacterial infection or other process. So this is the oral cavity and the containing teeth, the 32 teeth in the form of pair, which that is contain incisor here, canine, two pairs, premolars and molars. So the molars also involve the gingivitis mostly, and this is the oral cavity. So let's begin to understand the anatomy of the teeth with a cross section here. So this is the teeth which that's contained inside is the pulp with nerves and blood vessel, while the outer protective layer is known as the enamel, and the dentine is the below the enamel, which that will both combine together to form a crown. So on the other hand, this is the pulp with nerves and blood vessel, which that will give the nourishment and the feeling sensation of the mastication during the grinding. So it will feel as well as the creation of pain due to the nerves. Pain receptor are present in the nerves, which that will feel the pain in the teeth. While this is the root canal, this root canal combining nerves and blood vessel. Basically, the pulp with nerves and blood vessel and root canal combine nerves and blood vessel is known as the root, while the crown is the upper part, and the gingiva is here. So this you can understand. The gingiva is a gums, which that you can understand. And let's begin to understand the bigger picture of the side of the teeth here, which that involve the gingival sulcus. So how it's possible to explain here with the diagram? Let's begin to understand. You can understand in this diagram. So I am drawing the bigger picture to understand where is the gingiva. So this is the basically is the here you can see this is the cementum, which that cementum is separate the teeth and gingiva, while this is the periodontal ligament are present in the red color and alveolar bone are present here. So in this way, here you can see this the gingival sulcus. The gingival sulcus are present in this manner, and this is the gingival margin. This is the gingival margin, and below the gingival margin, the free gingival groove. This free gingival groove are present between the gingival margin and free gingival groove. The free gingiva are present. This free gingiva, it is you can understand, while here is between the free gingiva groove and the mucogingival junction, the attached gingiva are present. So the free gingiva and attached gingiva will separate through free gingiva groove, while here you can see the alveolar mucosa are present between the down, and here you can see and understand the. So the Latin word the gingiva means the gingi, and it is itis is mean inflammation. So the gingivitis means the gingi inflammation, the gingiva inflammation. So remember that is related to the gingiva means the gingi. So the gingiva is refers to gingival inflammation induced by bacterial inflammation induced by bacterial biofilms biofilms so called plaque adherent to teeth surfaces. So the bacterial plaque is accumulation in the spaces between the gums and teeth and calculus tartara that forms on the teeth. So the microscopic accumulation of microorganism provides toxin, chemicals lead to inflammation and lead to activation of immune cell of the gums around teeth. So activation of the immune cell will lead to inflammation, cause the sensation of pain through nerves, the basically pulp with nerves and blood vessels. So anyhow, let's begin to understand the inflammation in the alveolar bone, which that alveolar bone erosion will be occur due to the inflammation will recruit the leukocyte like a neutrophil, which that produce cytokines and also the tumor necrotic growth factors, and which that will lead to rank L bind or stimulate via a cytokines to osteoclast activity enhancement. After the enhancement of the osteoclast activity lead to bone degradation, and the bone degradation will lead to brittle bone and cause the erosion of the teeth. So anyhow, this was the teeth anatomy. We had discussed about the gingiva and the teeth. Let's begin to understand the gingivitis stage first. So the stage first is the initial lesion, and the stage two is the early lesion, late and lead to late lesion. We will let's begin to understand the initial lesion mean that it can be a subclinical symptoms you can understand, and now let's begin to understand the stage one, the initial lesion. So the initial lesion is meaning that the inflammation or vascular changes the consisting of the dilated capillary and is and increase blood flow. So when increase the blood flow, the facilitation of the leukocyte will lead to move where the infection site. So after this infection site movement, the microbial activation will lead to basically the microbial activation will occur, and the immune cell are ultimately activation due to the endothelial cell stimulation will lead to leukocytes activation. After the leukocyte activation, the inflammation will enhance, and in this way the basically the immune cell activation will lead to inflammation and pain due to the production of cytokines and the inflammatory mediators. And the subclinical gingivitis is the plaque cavitation. This plaque cavitation will lead to not moving side still, so the inflammation will occur in the pulp with nerves and blood vessel, where pulp which that will inflame will feel the pain, and the plaque in gingiva will occur. This is the yellowish color plaque showing in the teeth. So after this, the perivascular connective tissue matrix becomes altered, and there is exudation and the deposition fibrin, which that will lead to basically lead to hardening of the teeth and cause the inflammation, lead to pain. So the in this way, the redness, pain, and swelling or edema in the gums, which that will lead to stage the initial lesion. This initial lesion can be treated in the home because it is the subclinical gingivitis, but we should refer into the hospital. So the redness, the reddish color of the gums and pain can be feel, and the swelling due to the edema, due to the filling of the fluid. It is known as the gingivital fluid. So the stage 2 is early lesion and late lesion we will discuss. So the early lesion evolves from the initial lesion within about 1 week after the beginning of plaque accumulation. While the clinical sign, let's begin to understand the clinical sign. So the clinical sign can be include the arrhythmia. So the erythema mean the reddish color of the gums, which that we can feel, and that's feeling erythema means the reddish color. And on the other hand, let's begin to understand here is the erythema and may appear due to angiogenesis, and the angiogenesis will increase mean the blood vessel development increase due to the growth factors, and bleeding of the gums, bleeding on probing may also be evident, and gingival fluid flow recruit after 2 weeks the leukocytes. So the gingival fluid flow recruitment of the leukocyte to the further inflammation and combating the bacterial infection, and the amount of the collagen and destruction increases. So the collagen amount of collagen destruction increases 70%, while the circular and the dentogingival fiber assemblies formation. After this, in this happening, the clinical sign, we can treatment. Before this clinical sign is a brush your teeth twice in a day with a fluoride rinse, and don't skip dental appointment and oral antibiotics, and avoid surgery. Avoid sugary food. And in this way, if this will not occur, so the surgical operate can be recover this gingivitis. So this video about the gingivitis and the teeth anatomy, I hope you make sense about these things. If you like this video, please make sure to subscribe, like and share, and give the comment below. So thanks for watching. We will see in the next video for this further proceed to understand the teeth anatomy. So thanks for watching. Bye.